Hello, everybody. It's Dr. Rafage at Triage. Let's do this. If any of you noticed that your dog's toes smell and they smell like tortillas or what are those called? Fritos, Fritos chips. And let's talk about it. Um, the most common location on the paw that we see this issue in dogs usually is between the digits, so the interdigital region, interdigital webs, or in between the paw pads. So the digital paw pads and the central paw pad. So basically, it's areas where there's like a crevice or a fold in the skin. Obviously, also another location is going to be where the digits meet the carpus, the main palm. But any area that bacteria and yeast can thrive in the dark, moist environment will create a minimum an odor and a maximum probably an infection. Um, dogs, some dogs just have a unique odor to them. Some don't have an odor as much. It just depends. Assuming, of course, nothing else is wrong with your dog. So just individual smells, and because they, of course, walk on all four legs, they don't usually wear any coverings for their paws. So it's no wonder that their toes begin to like smell, right? So there's a smell to them. But the question is this something that's concerning enough that you have to act on it? Well, it depends. So if you have just kind of an odor, it's always been there. It might be just your dog's normal thing. Although there are some things you can do to try and alleviate it. You could try and have them wear booties when they go outside, but those booties can't stay on all day long. Otherwise, it's going to cause more moisture buildup in the paws. So I'm not sure how much that'll help. The other thing you could consider is whenever they come from outside or whatever, you can just wipe the paw pads, wipe any debris or dirt off of them. Or there's also these wipes that are anti-yeast, antibacterial for dogs that you can use to clean between the toes and see what that does after a few weeks of that. The other option you have too is to try and improve the health of the skin and paw pads and nail beds. So fish oil supplements, omega-3, omega-6 fatty acids, fish oil, krill oil. These provide omegas for dogs, and it helps not just their skin, but also the joints and GI tracts and stuff. But in this case, you could try to help, and I would do it twice a day. There's plenty of products to look up what people are talking about with it. And then if the pet is showing any sort of symptoms that relate to inflammation or infection of the digits, whether it's one leg or all four, then it warrants going the next step up, which is talking to a veterinarian, and of course, vet triage can help. Now, if you're noticing the odor on only one paw, then chances are it's probably not a normal thing for your dog. But if you're noticing on all four paws, then it will be, you could consider it more normal for your dog, especially if it's always been there. Maybe you got used to it, then you had guests over and they kind of smell the paws because they're not used to your dog's smell. So that's one indication that it's normal or fine versus it's a problem. If it's 1 foot, it's a problem, or two, anything less than 4 feet, it's a problem. If it's four paws, then it may be normal. But otherwise, you're going based on symptoms, and symptoms are going to include things like limping on the affected limb or limbs, constant licking. I mean, they just go to town on the interdigital regions and in between the pads. So constant licking. And then if you happen to spread the toes, sometimes they won't even let you touch them. They're so painful. But they let you touch them, you'll see that there's all this redness to the skin. The hair is all wet. It smells even worse. And you may even see pus, like green or white discharge because of the bacterial overgrowth. And so we call that moist dermatitis, or it's specifically happening in the digits. It's called pododermatitis. And that's an indication that we should have a veterinarian at least consult with you to see what home remedies you can apply, and then whether or not you need to actually go in for testing and more medications at your family vet in person. Depends. So that's what we would end up recommending. So if there's any sort of symptoms associated with this, then you want to get it checked out. And then the rare situation, very, very rare, that this is a recurrent problem. The dog just keeps having severe infections. I've only done this surgery one time in my 18 years, a podoplasty, where you actually remove all the webbing between the digits and you fuse the digits together. Now that sounds horrible for us as people, because like if we had to walk around like penguins, it'd be a problem. You can't write, you can't drive, you can't do stuff. But for dogs, especially ones that are like have just severe pain and chronic infections and multi-resistant bacteria, it's a quality of life issue at that point after you've tried months or even years, usually years, of antibiotics and anti-yeast and all this stuff. And you have just removed you have to fuse the digits. So a fusion podoplasty, it would be the treatment of choice. The one that I did was successful. It worked. Now there's a possibility that with that surgery, your dog could have an abnormal gait, because, the spreading of the paws whenever they step down is important to have grip. It's important for running. If you can't spread, if you're stuck like this, then it could affect their gait. But they probably will not know the difference. And really, by the time a dog has this issue, they're usually middle-aged to older, which means they're not as active, not running around as much. If your dog hunts or swims, are their career over? Is their career over? No, probably not. They probably still can like hunt and swim and whatever. Just be aware that they don't have the same webbing they did before. I imagine, we can assume if it's rare to see it in one paw, it's certainly going to be even more rare to see it in multiple paws. But anyway, I don't know why some dogs have this craziness, but again, it's super, super rare that it's that bad that you need surgery. Most of the time, medications, home remedies, things like that. So yeah, that's how I would tackle the smell with your dog. Now, if you notice that it's coming and going, but there's no other symptoms, then keep in mind whether or not your dog likes jumping in puddles, or maybe every time it rains, that's when your dog is out and about. And so that rain, that wetness, similar to if they're going swimming in your pool or swimming in the lake or an ocean, you want to dry their pads off. So just dry it off, and that'll help prevent it, because you can't really stop them from going in the rain. They have to go outside. So yeah, that's it for today, folks. Thanks so much for listening. It is, by the way, Thursday, September 12th, 5:30 p.m. Pacific time. I'll be back on tomorrow, September 13th, for another video. We'll talk to you guys soon. Thanks to everybody who watched on the playback and who support the channel. Bye.